Hi everyone, we're gonna get started. Welcome to this Allergy Open Evening, and it's a great pleasure to be here. My name is Dr. Marta Vazquez-Ortiz, and I'm the Director of the Postgraduate Program in Allergy at Imperial. I'm also a consultant in pediatric allergy at Imperial NHS. And we have a bit of a busy agenda today, and it's lovely to have quite a few of you already who have joined. So this is what we're going to be talking about. So I'm going to be talking about the Allergy Postgraduate Program at the Imperial for about 10 minutes, then a little insight into the clinical services feeding into the program. And then we will have Professor Adnan Kustovic giving us a little overview about the allergy research at Imperial. And we're lucky to have two of our students, Dr. Nina Atzet and Dr. Fiona McGee, talking about their students' experience with us over the last few years. And hopefully we'll have about 20 minutes at the end for our Q&A. So please send us any questions you might have throughout the different presentations. So put them in the chat, and we will be filtering questions throughout the chat and address them at the end. Okay, so that's the plan for today. And in the interest of time, I'm going to get started with the Allergy Postgraduate Program at Imperial. And I believe if you want to become an expert in allergy, this is very much the place to be. So welcome everyone to this info session. So why to choose Imperial? Of course, there are other education opportunities out there. We really believe there's nothing like our allergy AOC, and partly is because Imperial is an amazing institution, and it's actually one of the top 10 universities worldwide, and it's actually 6. So this is news from 2 weeks ago with the new rank of universities from around the world. So very strong position. And these are also news from the last year. So Imperial named University of the Year based on the teaching in the UK, and that was very much as a result of the response to the COVID pandemic, where the teaching was enhanced and improved, kind of rising up to the challenges. And this is also very recent. Imperial top in research in the UK based on this survey. So, and then when it comes to allergy, we kind of like to say that Imperial is probably the home of allergies, one of the kind of very institutions in the world where allergy has developed as a scientific specialty. And it was here at, now it's Imperial, so at St. Mary's Hospital, where we're still based in Paddington, where Noonan Freeman over 100 years ago developed for the first time allergen-specific immunotherapy, and they published that in the Lancet at the time. And then very outstanding figures in the field of allergy and asthma over the last decades were based at Imperial as well. Dr. Brill Frankland, who did amazing contributions to clinical practice and research in allergy, including the first clinical trial in allergen-specific immunotherapy in the 50s, also based at St. Mary's Hospital. And Professor Barry Kay, who did fantastic contribution with his research to our understanding of the mechanisms of asthma, T2 asthma and eosinophilic inflammation, which has paved the way then for new therapeutics like biologics in kind of more sort of modern times. And sadly, both passed away a couple of years ago, but they have an impressive legacy. And it's in this context of excellence that we're very lucky to have an amazing faculty for our program, and we're able to offer world-class teaching. So it's really this range of experts, many world-leading experts in their fields, and you might recognize some familiar faces there if you're in the field of allergy. And they all fall under the umbrella of NHLI as academics, and most of them also as basic clinicians within the public healthcare system here in the UK. So very much in contact with what matters to patients and society. And it's having them as module leads that allows us to have an extensive syllabus covering all the different aspects in allergy. And we have very much a student-centered active learning approach. It's a very flexible program, part-time, blended, and now with an online stream to follow fully online if you wish to, and a very international atmosphere, both from the faculty perspective, both with our internal speakers, as well as a range of international experts and our students who also come from very sort of various backgrounds, as you will see. And these all falls under, as I say, NHLI, and we've been awarded Centre of Excellence in Allergy by the World Allergy Organization recently, and the clinical services are very much within Imperial NHS as well as the Royal Brompton Hospital, all in London. And this is a bit about our students. So we have a range of students, predominantly healthcare professionals, but not only, I will say, and we have quite a few doctors from different specialties, as well as nurses, dietitians, pharmacists, etc. Also some basic science people, as well as others such as epidemiologists or pharmacists and people working in industry, really wanting to enhance their career in the field of asthma or allergy. And this is the last 5 years. We've had 100 students, half of them from the UK, 30% European Union or Ireland, 20% overseas. And you see the range of countries you see, and that brings a lot of richness to the program and the cohorts of students we have. And of course, because allergy is a global problem that manifests differently in different regions, that also brings a lot of richness to the learning, and we all learn from each other, and it's really exciting and interesting. So now going a bit more into the detail about the actual program and modules and teaching. So this is the structure of the program. So we have different levels. And as you see, it's a part-time program. So most of our students continue to work, usually full-time or nearly full-time in their usual jobs, as well as taking part in the program. And everybody starts with the first year, so by registering for postgraduate certificate. And in that first year, you will complete 3 core modules. So the first is the scientific basis of allergy, very much covering the immunology underpinning allergy, so the mechanisms and how these correlate with the clinical presentation, the diagnostic workup, and the therapeutics. And then we have another second module on the diagnosis and treatment of allergic disease, a much more clinical and practical module there. And then we end up with the cutting edge of allergy, where we cover the latest in research, very often with strong clinical implications. And also we give you the tools to develop research skills and critical appraisal skills, both to develop your own projects within the program and in the future, as well as to continue to learn, say, long life, about this fantastic specialty. Okay, very few people exit at that point. Most people continue and progress into the second year, and then completing the first year modules as well as the second year modules will give you the postgraduate diploma. And in the second year, we basically cover the key areas within allergy in much more depth. And you see here food hypersensitivity, rhinitis and immunotherapy, asthma and allergic disease, allergic skin disease, and pediatric allergy. And then you might exit there, but lots of our students continue into the research project year to exit with an MSc. And you could do the project within the third year as a standalone issue thing, or you could do it within the second year, so a very busy second year, okay? And research projects, some students do it with us, with imperial projects, imperial supervisors entirely. Many of our students prefer to do a research project in their own institutions and in their own country with a local supervisor, as well as a supervisor from imperial for support and co-supervision. So this is the structure there. And then how do we teach? So now we have 2 streams. We have a pure online stream as well as a blended stream. So the blended stream includes on-campus teaching in London once per term. So that's 3 times a year, okay? And then we have a range of materials, on one side, asynchronous materials, so that's materials you can access in your own time, and we generally release them about a month before, the bulk of the live teaching, so you have time to access all of those materials, and that includes lectures and mini lectures for you to look at, on your own time, practical demos, interactive tasks to work individually and within groups, reading lists, as well as other web-based resources. And then we have the synchronous teaching, which is when we get together, so live sessions, both online as well as on campus for the blended stream. And there it's basically for interaction, for questions and answers, for discussions around cases or particular topics. And there's quite a lot of learning by doing individually as well as in groups. Lots of active learning opportunities for debates, presentations, hands-on sessions. And then part of the on-campus sessions are live streamed, and the online stream people can, of course, take part, speak, present, ask questions. Is very much a kind of a sort of a hybrid format we've been using throughout COVID, and it's worked really well. And this is the basis for kind of having two cohorts very much coexisting within the same program. And this is basically how we structure our module, say. So we do our launch webinar, say on week 1, where we present a module in a lot of detail to help you prepare. We release all the asynchronous material so you can start working on that. And then say on week 3, we have a live online session that we call a warm-up session with questions and answers and focused discussions on key topics. And then we have the main teaching week, say week 5, main teaching week. That's how students generally take as leave the whole week. And that's where we focus mainly for the live teaching. So usually Monday and Tuesday we do live online teaching, and then Thursday and or Friday we do the on-campus teaching. Okay, and then 4 to 5 weeks after that you will have your assessment for that particular module. Okay, so that's say for the 3 modules in year 1, and in the year 2 modules, so the smaller modules get sort of combined, so we follow the same structure with kind of 2 modules together. So assessments, there are a range of assessments, all trying to mimic tasks you probably will have to do at some point in your professional career in the field of allergy. And that helps you develop a range of skills and really feel comfortable as an expert in allergy. And that can include written exam, case report, presentations and written case reports, running a mock allergy clinic, writing a research grant application, presenting a poster or an oral presentation, writing a patient leaflet or review papers. And then the MSc thesis, which follows the format of an original research article, and then it's easy for you to publish that if you wish to, which many of our students do, of course. And then it comes to fees. Okay, so these are the fees for home students, and home students mean UK and Ireland. So for the first years, the PGCert is about so 6K, both for the blended and the online stream. And that's a bit higher for the overseas students. For the online stream is about 10K, and the blended is a bit more expensive. So it's nearly 19K for the first year. And then as you go up, say in year 2, you pay the top-up fees. To say the home students pay in the second year £3,000, and the MSc year 2 1,600. So it's kind of a bit complex how it comes in the website, but that's basically how it is. And we're offering scholarships this year, so 3 scholarships for 3K and 5 scholarships at 2K, and that's open both for home students as well as international students, both for applicants to the blended as well as the online stream. And the deadline is the 14th of July, and we very much encourage you to apply. To be able to apply, you have to have applied to the program, and yeah, we very much encourage you to do that. Okay, so there's a link at the bottom that you can follow for that. And then deadlines for applications in the portal. So that's not scholarships, it's actually applying for the program to start in October. So the blended overseas, so those people based overseas who want to come to the on-campus teaching, that's end of July because there are visa requirements, etc. And for online stream and home students in the blended stream, that's end of August. And the college, of course, is very strict with deadlines. So please don't miss the deadline if you want to apply, okay, and do it as soon as possible, really. And that's all from me in terms of the program. So I'm going to move on to the clinical services very quickly. And this is very much the 4 centres that feed very much into the allergy MSc. So mainly Imperial NHS Trust and Royal Brompton, and you see St Mary's Hospital with a paediatric and an adult allergy service, the Brompton with an adult and respiratory medical service, of course, and an adult allergy service, Chelsea and Westminster Hospital with dermatology and gastroenterology, and Charing Cross with adult and paediatric ENT. And then very briefly, so Imperial NHS is the first academic healthcare sciences centre with a focus on excellence in clinical care research and education, and is the largest hospital trust in the UK. I'm going to mainly focus on the paediatric allergy service because that's where I work and I know well, and that will give you a bit of an overview of how those tertiary quaternary services are organized in the UK. Okay, so our pediatric allergy service is one of the largest in Europe. We see over 6,000 kids a year with a whole spectrum of allergic disease. We reference from Northwest London, and we have a focus on complex patients, holistic care, and patient education. We have trainees from the UK as well as international fellows. And we are very much a very multidisciplinary team with pediatric allergists. So you see a bit of a long list there, specialist nurses, dietitians, speech and language, and a psychologist. And the areas of expertise and interest are complex multi-system allergic disease, complex food allergy, including food-induced eczema and gastrointestinal food allergy, adolescent transition, health education, and translational research, including food immunotherapy. And we have, as you can imagine, late case procedures, so drug food challenges, immunotherapy, biologics, and we get referrals from all levels of care as well as internal referrals. And we have a range of clinics from general allergy clinics to immunotherapy, complex multi-system allergy, joint clinics with other specialist consultants in those fields of complex gastrointestinal allergy, difficult eczema, and difficult asthma that we run together with the Brompton team. Adolescent transition clinic, dietetic-led clinics, nurse-led clinics for general allergy as well as education. And this is just a little overview about the service at the Brompton with a strong focus on problematic severe asthma, trying to tell apart what's difficult asthma, where there are modifiable factors, where behavior change and good clinical multidisciplinary teamwork can make a huge difference, and tell apart that from severe asthma and the work together, clinicians and academics, in phenotyping and finding biomarkers and targeted therapies for that. And we work very closely with them, and they're amazing contributors to the program. And that's all from me. So I will be there, of course, for the questions. And now I'm going to hand over to Adnan to talk about the research at Imperial. So thanks for listening.
Hi, everybody. Hi, Marta. Thanks very much for that great introduction. My name is Anna Trustovich. I'm professor of pediatric allergy and head of allergy at the Institute of Pediatric and Child's Health at Imperial. I'm going to give you just a flavor of allergy research at Imperial, starting from the beginning. And it is important to start from the beginning because in reality, the intellectual and institutional origins of allergy as a clinical and scientific discipline lie in what today is Imperial College and NHLI. Where are we today? Well, today we host world-beating allergy research. We're number 2 in the world. We're number 1 in Europe, number 1 in the UK. If you want to go to the number 1 world center, try Harvard, but hurry up because we have every intention to be number 1 next year. And, you know, that tradition is tremendously important because this is where allergy as scientific discipline has started. In this very room in St. Mary's Hospital, these extraordinary 2 gentlemen, Leonard Nord and John Freeman, working with Elmer Wright, administered the first injection of allergen-specific immunotherapy in 1907. They actually published the results of their work in 1911 and have demonstrated that subcutaneous pollen injections for hay fever result in 100-fold increase in reaction threshold. Why was this so spectacular? Well, this actually was the first time where rather than having passive immunization, they opted for active immunization. Elmer Wright said, sort of at the cusp of 2 centuries, that the next big doctors are going to be vaccinators. How true that was. Also, they were spectacular in recognizing that this form of treatment also is associated with sometimes severe attacks. Leonard Noon passed away very, very, very young, and John Freeman wrote wonderful, wonderful obituary. It is also well worth reading an obituary that great Karl Prausnitz wrote about John Freeman. Karl Prausnitz himself passed away in 1963. So extraordinary foundation. You will all know this gentleman, Alexander Fleming, who in that same building actually discovered penicillin. And there's a wonderful story about the contribution of allergy and allergists to the discovery of penicillin, but that we'll tell you when you join the course. Working with Alex Fleming, or Sandy, as he was known at the time, was this gentleman, another extraordinary guy, Bill Frankland. Now, Bill Frankland was extraordinarily bright, really great guy, managed to survive Japanese camps for war prisoners, worked with Alexander Fleming, and it is really interesting to see what their opinion was about potential of penicillin causing allergic reactions, which were recognized very early. Fleming, in his obsession with penicillin, thought that the more recent penicillin preparation were very unlikely to cause local or general reactions. Bill recognized that with increased use of penicillin, allergic reactions were bound to become more common. And you will all have come across the issue of penicillin allergy and drug allergy, and that is certainly part of the curriculum that we will cover in our course. Now, Bill then went on to do extraordinary things, extending the work that has started at the end of 19th, beginning of 20th century, carrying out the first proper double-blind randomized placebo-controlled trial of immunotherapy, demonstrating excellent or very good results in those patients who were treated with purified pollen, but not with those with ultrafiltrate, really suggesting that it was protein in the purified pollen extract that were contributing to this extraordinary beneficial effect. Bill then went on to set up a huge allergy clinic at St. Mary's Hospital. You know, the numbers that we're talking now, 5,000 to 6,000 children, in those days, they had thousands of patients with hay fever. So the first wave of allergy epidemics was addressed both scientifically and clinically by Bill Frankland. Bill's contribution to allergy in general is extraordinary. He put on the top of St. Mary's Hospital, here's the top of a hospital that you will see, a pollen counter, and he managed to establish a clear relationship between pollen count, severity of symptoms, and then came up with a warning system for his patients. Bill was an extraordinary guy. He practiced medicine. He wrote papers until the age of 105. This is Claudia Gore and myself in one of the last visits to Bill. We currently in St. Mary's have 3 winners of the greatest award that BSACI, British Society of Allergy and Clinical Immunology Awards, for those who contribute to the development of clinical allergy, in Claudia, myself, and this very year, Dr. Paul Turner, one of the faculty. Bill used to come and give lectures to all of our students up until the last one being 2018. He was extraordinary, and he pulled all of his effort and energy in education of new generations. His contribution to St. Mary's, to Imperial, and to allergy cannot be overstated. He also was very interested in fungal allergens and how this contributed to severe asthma, and it opened up a whole new arena of research about 30 years after he first noticed a strong association between severe asthma and allergy to fungi. Then came Steve Durham and his extraordinary, absolutely unbelievable studies that went on over decades, in which he established beyond doubt that immunotherapy when administered over a period 1 year, is indeed effective, but does not lead to desensitization. But when administered for 3 years, then it results in long-term unresponsiveness. And extending it up to 7 years doesn't really contribute to anything else. And for those of you who join, you will have the pleasure and privilege of listening to Steve talking about all of these studies that went on over decades and decades and decades. For now, 115 years after the first injection has been actually administered, Mo Shamji, another one of our faculty and reader in our group, finally managed to describe the actual mechanism of allergen-specific immunotherapy. Martha mentioned Barry Kay, another dear, great friend who passed away in 2020, who established a number of techniques from immunochemistry to flow cytometry that enabled him to prove the critical role of T cells in bronchial asthma, and demonstrated that Th2 or now T2 mechanisms are critically important. And then 25 years later, after this discovery, this was translated into biologics that are now transforming the quality of life of patients with asthma. We are genuinely sort of standing on shoulders of giants. Today, we are the largest clinical service. We are our center of excellence. Our team has been awarded Best Hospital Clinical Team by Allergy UK, but that all is underpinned by spectacular research. Our key research areas are on food immunotherapy, allergen immunotherapy for respiratory diseases. So this tradition of 120 years is continuing. Most important areas of interest now: mechanism of anaphylaxis, endotype discovery, personalization of treatment. Large proportions of our course are devoted to cutting-edge science that you will be exposed to even before it's published in a major journal. We're interested in primary prevention, in the mechanism of immune tolerance, and obviously all of this feeds into postgrad course that Marta is leading. Currently, we are integrating extraordinarily quality of clinical research with basic science wet labs, which are on South Kent campus that you will have an opportunity to see, and dry lab, our data scientists that are contributing to the course by trying to teach students about cutting edge analytical techniques. All of this is then translated into clinical practice through our clinical service, and the ethos of the whole team is to remove these artificial divisions that people are talking about: clinical research, basic science, and data science. We all are bringing it together to foster genuine cross-disciplinary collaboration with a focus on lifelong health. We want healthy individuals. Our focus is not disease. Extraordinary number of birth cohorts, patient cohorts, randomized controls, trials, fantastic mechanistic studies in mouse and human experiments, all underpinned by cutting-edge analytics and deep phenotyping. This is really important for those of you who may wish to continue into doing masters, because if you cannot identify your own project, there are a lot of opportunities within Imperial to move on and do the masters. And all of these extraordinary people, most of them being amongst the top or the top of the research, are in the faculty. Unfortunately, this slide is far too small to put them all in. So if you want to become an expert in allergy, if you think allergy is interesting, if this is something that drives your imagination, I would strongly encourage you to join our course and join us. And of course, we will be more than happy to address any of questions or queries that you may have.
Thanks so much, Adnan. That's brilliant overview over the years. So we're now going to move on to our students. So I'm not sure who wants to go first. Shall we start with Fiona?
Sure, yeah. Hi, everyone. I'll just share my screen there for a minute. So nice to talk to you all. Should be able to put this up here. So I'm only going to talk for a few minutes. So I'm a student on the allergy program, and I'm just coming to the end of my second year of the postgraduate diploma. When I started out, I wasn't sure that I would go the whole hog to the masters, but at this point, I'm definitely going to go ahead and do the last year. So I'm a GP from Ireland, and I had been interested in allergy, and now with a bit of time spent in the course and having learned a lot, I was in a position to co-run a GP-led allergy clinic, and that was just in the last few months. So I felt really confident doing that with all that I had learned on the course. And I'm just finally getting ready to start my own allergy clinic in my own GP practice. And that's where I'm going to conduct my research project from. So in terms of the course, I mean, I couldn't recommend it highly enough. It definitely has exceeded all of my expectations. I think it's a big decision, for pretty much all of us are working in some field or another. And it is obviously a big decision to take on postgraduate studies. My first year was in 2021, so kind of early in the pandemic. So the first year it was all remote learning. There was no other option. Everything was from home, and the entire university and most universities were operating that way. So I know the faculty had to very rapidly convert the course to online, but it actually worked incredibly well. And we actually managed to get to know the faculty and our classmates really well, despite being doing distance learning. So the group, my peer group, there's 20 something of us, and we're from all backgrounds, doctors who are pediatricians, GPs, some adult medicine specialists, there are allergy nurses, there are some non-clinicians with science backgrounds, and people are from all over the world. But we've really had, a great group, and that really kind of made the course for us. And we've had great support. We really have throughout supported each other throughout all, which has been really fantastic. And obviously in the second year, we had the opportunity to come to London and do a kind of combined remote and in-person. And that was wonderful to get together and to come to Imperial and see where it was all happening. The faculty teaching are, the faculty who teach us are just absolutely fantastic, very accessible and very supportive. Really, when we have our lectures, the spread, each person teaching us is very much an expert in their field, and it's quite incredible. In the first module, which is the scientific basis, I was quite amazed, like the lecturers teaching us, each one had sort of dedicated their life to a very specific area of allergy. So there's a really broad range between epidemiologists, people, like Dr. Moshanji, who's very much lab-based, amazing research, clinicians, dietitians, really, and that really gives a very kind of well-rounded aspect to the teaching. The workload is significant. I think it's a significant qualification that you get at whichever level you go to, and that doesn't come easily, but it is doable. Everybody on our course was working full time and was juggling a lot of other things. I think sometimes I'd come to the course feeling that I had too much on my plate and too much going on, and then you'd realize somebody else had just had a baby or their house had been flooded, or so I think everyone has a lot going on, and everybody was juggling their jobs and very often all the additional work that came with COVID in our clinical roles, and yet we all kind of got through it. And certainly personally I found it a very positive outlet during COVID. I think it was helpful that we didn't have a social life in the first year, that allowed a bit more time to study, but meeting everyone on the course was a really, really nice outlet. So I think the way the workload is set up, the fact that we get the lectures in advance of the modules, it does allow people to do the lectures in advance in their own time. The assignments, we liked to give out about them sometimes, and there was quite a bit of workload involved, but the bottom line was we always knew the topic so much better after them, and they were very varied, and they really did reflect what we should know at the end of the course. They were very much based with our kind of competencies in mind. And I certainly knew that if I had just done the lectures and the reading, you know, if it wasn't for the assignments, my learning wouldn't have been as deep. So it makes you go and kind of look at all the papers on a topic and know it inside out. So it was great. So my advice would be do it if you are interested in allergy, and if you think that a qualification in allergy would benefit your career, do it, and do it at Imperial. Consider going the whole way, but you know, you don't have to decide that at the start. So you can just take it one step at a time, start with a postgraduate cert and see how you get on. You know, just take it step by step. I think do expect that it will take up some of your time, but it comes in bursts. You know, each module is busy, but there is breathing space in between them where you can kind of take a break and go back to your hobbies and do other things. I think if you're doing it, just engage fully. It's not something just to kind of scrape by. That's, you know, we're all adult learners and we're doing it because we're interested. So I think engage fully. You know, the papers that are put up on the reading list, I don't think I certainly didn't get through them all, but they are divided into core reading or supplementary reading. So I think focusing on the core reading allows you to focus on what's really considered essential papers related to each topic. I think in our group, we all agreed that the first module was the hardest. So unless you are already an immunologist, it's difficult, but it was incredibly interesting. You know, it basically gave us all the basis for understanding the mechanisms which underpin everything in allergy. So the subsequent modules definitely seem easier in comparison, and it all gets more interesting. And the second year very much builds on the first. It just goes into kind of greater depth on all the topics. I think engaging with your groups is really important. I got to know my small group really well in the first year without ever meeting them. And I think with all the group, it was quite emotional when we kind of finally got to meet together and see each other in person. So yeah, I couldn't recommend it highly enough. And it's been a great experience for me so far.
Thanks so much, Fiona, for your extremely kind words and your overview of your experience. That's great. Thank you. And Nina, your turn now. And we'll be very happy, you know, for students to ask questions to our students as well. So, you know, not just from us. Great, Nina.
So hi, everyone. I'm Nina from Germany. I'm a pediatrician from Germany, and I got most of my training in Switzerland, and I'm very happy to talk to you today. So let me share my experience at Imperial, and I wanted to address some topics, some questions you probably have in mind. So I will start for reasons that were very important for me, and now with my experience that I had. So first of all, what Marta already pointed out, you're actually really meeting great people from all over the world. So in our cohort, we had people from Singapore, from Kenya dialing in, from the UK, obviously, from Ireland, me from Switzerland, but also from Croatia. So it was an amazing cohort. So this program gives you a huge and great combination of basics. And as Fiona was just saying, yes, immunology is involved, but even I got it. And they really want you to understand it. And it's so helpful once you know, bit by bit, you will get through it. And there are so many practical aspects. We just had in our last module, the how was it called? The eczema messy play. And it was really messy, but it was so much fun. And you really know how to do it now. And up-to-date research. I cannot emphasize on it enough. Amazing speakers. You know, when you read research papers now, you will be familiar with all the names. And it's just so cool to having lectures from them. It's a extremely high quality of education. And I think there's kind of a spirit there once you're in there. It's a great Imperial community, going to be part of it. You have a fantastic program leader. I really have to say it. You can always get in touch with them and get huge support and very speedy replies. So what will the program education provide me with? So it sounds probably like a boring business school advertisement, huge network, but it is like that. And I don't mean it in this business kind of talking, but it's, for example, when we had problems in our clinics or had tricky cases, we could bring it to our class and discuss it with everyone. So it was really supportive. Also for your personal development, I think it's very important. You feel more self-confident now approaching a patient or giving instructions, and also for your professional development. Maybe you want to advance and take a next step in your career. They definitely give you the skills, the background, and the motivation to do so. And I think everyone kind of in our cohort thought about it, doing something different in his or her career. So you will develop different skills you didn't even know you had them. Maybe research, or for me, it was the last assignment. Actually, I love drug allergies. I had no idea I was so interested in that, but it's really, you get so much information and you make most of it. And what I really love, and this is, I think, why I also picked it, I wanted to know how others are doing it. And then in Peoria, you have this holistic approach. For example, if you have a child with food allergies, you do not only look at the food allergies, but also growth, nutrition, later on transition process, and so on. So there's really a lot to learn, and you will learn it. So next question, is it possible to combine the program with a busy work and family schedule? And definitely a yes, but from me, some recommendation to make it work and to actually enjoy it. Try to take leave during that week when you have that online teaching, or get your partner involved, or babysitters or grandparents. Make really sure you can focus on your program. Try to prepare as much as you can in advance. You get all this amazing asynchronous material. I, for example, sometimes did it on my commute. I could just dial in and listen to the lectures. Or if you can't make it, everything will be recorded. So if you are on duty or sick on that day, so you have many, many options. And what we did, and what Fiona already pointed out, we got in touch with our cohort. So we have this WhatsApp group, and it's just so helpful because we're all facing the same problems. And just today we had an assignment due. And so you can imagine the WhatsApp group was very, very busy these last days. So it's really helpful. And I have to say, it's not competitive. It's always supportive. And last but not least, how's the mixture of the face-to-face and virtually online? So you have these lectures and you can watch them in your own time. And I think for most of us, this was very helpful. And you can dial in from wherever you are. We had one colleague, she was usually, because of the time distance, dialing in from her car on her way back from work. So it is possible. You can eat and drink while on mute or when the camera is off. So just some advantages, and it saves time with the commute. But honestly, I mean, nothing beats meeting your cohort for the first time in person after 1 year of online classes only. So this was for all of us, I think, very, very amazing. And for me personally, traveling to London is always so exciting. And for that week, you can really focus and don't get distracted by your normal routine. And here are some impressions from our last module. So we had an anaphylaxis training, and this is definitely something so much better face-to-face, and was so much fun. So thank you very much.
Thanks, Nina. Thanks so much. Great overview. So the floor is open for questions, and we're doing quite okay with time. So we have a few questions already in the chat that I'm going to try and address. So there's one about, someone, so just trying to get the name back up, someone who has very much a clinical background as a general pediatrician with no academic or research background, and asking whether it's all going to be too much for someone with a very clinical background. I'm happy to say my bit, but then probably Nina and Fiona, who come from very sort of clinical backgrounds, can also, of course, say their bit. So I will say most of our students come from clinical backgrounds with a very strong, say, clinical focus in their career, but of course wanting to improve how they do things, so wanting to improve the care they provide to their patients, and really know what's the evidence behind our decision making, etc. And when you want to kind of go deep and really understand and choose well, you need to know kind of the research behind it. So I think it all relates very much to clinical practice when you're a clinician. It can also be very interesting and applicable if you're not a clinician and you say in research, working in industry, etc. But the program is very sort of clinically oriented. It has a strong clinical component. And I think it all makes sense and it's interesting, and that makes you to want to learn. And of course, it's all a learning curve, and everything builds on kind of what we're already learning, etc. So you get those skills to interpret research and appraise the literature, etc. So that's what I would say. But happy to let Fiona and Nina say about their experience.
Yeah, I mean, I would agree. I think I'm not really aware of anyone in our group who had specific research experience. I'm sure some people had, but primarily we were all clinical. And, we are kind of taught the basics as well. I certainly feel I can read papers much better than I ever learned in just doing journal clubs in clinical work. And with one of our assignments at the end of last year, which was a research proposal, Marta did a session with us, and I felt I really needed it, actually, just going back to basics about the different types of study design stuff. Maybe you feel you should know and you've heard of them, you know the name, but like, what actually are they? So there is basics are covered as well as the more in-depth and complex stuff. So I don't think it would be beyond anybody to do this. You just learn it one step at a time.
Yeah, completely agree, because I just had a clinical background, and it's usually the stuff that everyone expects you to know, and you never ever have I read anything about it. So, and they guide you through it. No one expects you on the first day to know everything. So the lectures are about, and this is what I mean, you can repeat the lectures even if you don't understand it for the first time. Some of us went through it many, many times. And so at some stage, and then the Q&As, you can always ask questions, and this really helps you. So don't worry.
It's not intimidating at all either. I think that's the thing, I realized that after the first module that you definitely never needed to be afraid of asking. There was no such thing as a stupid question. I know everyone says that, but really everybody who was teaching us was so kind of open and never made anybody feel stupid, I would think.
I think exposure to research side makes you a better clinical doctor. Don't forget, we all start being 100% clinical. So don't be intimidated. Don't worry. You'll be a much better physician after that.
Great, thanks for all these insights. So another question that came through is about the online stream that is only available at the moment for postgraduate certificate, so the first year. So that's the case, and this is because the college has basically asked us to sort of implement that with the first cohort, and then this year say get approval and do all the paperwork we have to do internally to implement that for the PG Dip year and MSc. So basically the plan is for this cohort that will start now as online only to be able to progress as online only if people wish to, throughout the whole program. Of course, we cannot guarantee that 100% because we still have to go through all the approvals. But of course, I guess the difficult bit was to kind of get started. So we're very optimistic about that, and we're hoping we can offer that. There were some discussions as well if people wanted to kind of move, say, from the online stream, the following year to the blended stream, that will be a possibility as well. So I hope that addresses that question. So that's that. And then there is another question about also the online stream and how it compares to the on-campus stream, and whether there is a clinical experience. I think it's in the question. So I will say, if you compare the online stream and the blended stream, I will say 85% of the teaching, 90% is shared, okay? And that's because a great part is done online, or part of the on-campus teaching can be live streamed in a way that the online cohort can take part actively, ask questions, address any issues, present, or even work as a team as at the same time as we work within groups. in the lecture theatre. So it's very much the hands-on stuff that you saw in Nina's pictures that, of course, you know, if you're sitting somewhere in Singapore on your own, you're not going to be able to do. But of course, we're addressing those very specific learning outcomes and skills with alternative online materials. Okay, so say something we do, as Nina showed, is anaphylaxis sim training. So we're now recording mock sim training where, you know, there's opportunities to kind of watch a video, stop, you get questions about, okay, what's going well, what's not going well, what should you do, etc. Of course, you could argue that's not exactly the same as, you know, being there in front of a patient or adult, you know, having to do something. But I will say, you know, on paper, you're really going through the same learning and the same scenarios. Okay, so it's very much the hands-on stuff that is different. And then people, you know, think a lot about, do I get clinical experience? I mean, we've realized also through the pandemic that you can do so much in allergy remotely, because a lot of what we do is about taking a very good clinical history, deciding on test, interpreting test in the context of a history, management decisions, how you approach education, etc. There's so much that you don't actually need to say, touch or see a patient. So there's a huge amount we've done and we're doing online that is still very much enhancing your clinical experience. We have a million cases we discuss on all sorts of areas and clinical decisions, etc. So it's very much, you're not going to sit in clinic. People in the blended, you know, people attending on campus, they don't sit in a clinic because it wouldn't be practical to do. But we have mock allergy clinics where we do role play, and we do that online as well as on campus. We have patients coming to talk to us, and again, we do that online as well as on campus. So there's a lot of clinical exposure, I will say, even in the online stream. And of course, sometimes the students will like to sit in clinic, and that's a completely separate thing, separate to the program, but you can approach us to do a clinical observership with us, either with us, say, in pediatric allergy at Imperial or in one of the adult services, and we can organize that as a completely separate thing. And we've had students over the years, so I coordinate that. So, you know, just have to kind of drop an email and we get things organized. And the trust has just opened again after COVID, so we're quite excited about that. So that's something else if people want to really sort of sit in clinic and see what comes through the door. But I really think the program gives you, you know, probably a very condensed experience that it will take you years to see if you were to sit in a clinic. Don't know if anyone wants to add, you know, our students who were remote for the whole of the first year, your experience in that sense.
I think Waleed has raised hands to ask question.
Okay, sorry, didn't see that. So Waleed, go ahead.
Yeah, thanks, Marta, Adnan, Nina, and Fiona. You made it very exciting, like I want to start tomorrow. So thank you for that. I guess I have two questions. Number one is, can we get a sense of the time commitment? Like, I know it's hard to do, like, to give exact number, but maybe just give a mean and a standard deviation so that in terms of planning the clinical time, I think it's important so that we are committed to the course and we actually, you know, put the time and effort to finish in time. So that's question number one. Question number two is there a plan to move into a competency-based program instead of, you know, finishing the module in a certain period of time? Because I think that would be probably a better way to go forward.
Great, good questions, and thanks for that. So the first one about the hours, I mean, again, I'm very happy to sort of hand over to the students. Basically, on paper, so the first year modules are 10 credit modules each. So, you know, if you go to, say, the module spec, that will tell you that these are around 250 hours of learning. And then when we count, say, the hours of asynchronous teaching, that's around 25 hours. Of course, people like to kind of stop the video, watch again, take notes, etc. So that might be a bit longer, but technically it's around 20, 25 hours. And then the live sessions are also around 25 to 30 hours. And then, of course, there's the hours into putting together the assignments, doing group work, etc. So that, that's your kind of 250. I will say, it's kind of a third of a full-time program if you look at the credits. So a full-time program will be 90 credits per year. This is 30 credits per year. So it's a third of a full-time. So say full-time is Monday to Friday. I will say that's, on average 1 day a week. But of course, as Fiona said, it comes in chunks. So some people might just focus to say the week before the teaching week and the teaching week, and then the assessment, one way or the other. Some people do lots at the weekend or evening. So it's very flexible in that sense. So that's the first bit. So I'm happy to go to Nina and Fiona and see if that, they agree with that.
Yes, absolutely agree with that, because what I underestimated in the first module and probably also in the second year are the time that you need for the assessments, because once the teaching week is over, you think, it's over now, then you have to do your writing and so on. So keep that in mind. This is all I want to say. And beforehand, you usually have 3 weeks before they launch the module, and then you get your asynchronous material. So bit by bit, you can watch the lectures and get used to everything. So I think that gives you plenty of time to prepare.
Great. I see a question about how tough are the assessments, but I see Fiona has answered. If the attendee is happy with that, probably we're going to skip that question. There was a question from Walid about competency-based program. I mean, it's not saying our plans to change the structure of the program in that sense. So, we basically, for now, we're going to continue as we are, if that makes sense. Okay, I'm just going through the chat. Am I missing any hands up or any questions in the chat? I think there are quite a few. Just trying to make my way through the chat, sorry. It's not showing fully, sorry about that. Any other questions you can see there, Adnan or Jen, please?
No, I think we've been through all that were in the chat, actually.
Fine.
I have another question, Marta. For some of us who are already, have already an established research program or running our own research program, can we incorporate that into, once we reach the 3rd year, can we build the MSc on our current program?
Yes.
Thank you.
You mean using, say, one of your projects or future projects as your MSc project?
Right.
Yes, you can. Of course, we like you to discuss, the plans with us and see, how we can sort of contribute or support. But absolutely, yeah.
Thanks.
I mean, what we do tend to do is to offer an Imperial co-supervisor to help you with any issues during that, should you wish to do so. Okay, just as an added help to get you through the project or.
Okay, awesome.
But lots of the students do their project locally, because that gives you a lot of reward, making a difference locally, say in a clinical service, or of course, within your research group. So absolutely. Great. So we don't have any more questions. So that's good. So please get in touch if you have any specific questions. I saw some questions about English requirements and entry requirements, etc. So Jen, are you happy to put our email in the chat? Probably, that's in the website and everything, but, just easy access to our program email as well to get in touch. And just a reminder, so say the deadline for the scholarships is on the 14th of July. So please do apply if you're interested. And the deadline to apply to the program is end of July for home blended and for overseas blended, and then end of August for home and home and the blended option. So basically, if you need a visa, you need to be in by the end of July. Okay. So any final comments from anyone? Nina, Fiona?
I can just highly recommend it. It's such a good program, honestly. And I have a Swiss and German background, and I have to say the teaching is so much better. So go for it, do it.
I did part of my medical training in Germany, and I got great teaching there as well. So I'm happy to hear that. Like, we kind of, yeah, okay, fantastic. So thanks so much, everyone, for joining today. And big thank you to Nina, Fiona, and Adnan for being there with me today, and Jen and Ellie for helping in the background. Okay. Good. Have a nice evening, everyone. Bye.
Hope to see many of you at the course. Would be a real pleasure.
Thank you.